Growth failure or short stature is a common problem encountered by parents, and it is one of the most common reasons they visit a doctor for evaluation and management. Growth is the best barometer of health as far as a particular child is concerned. Nutrition is absolutely important. Having more of green leafy vegetables, having more in terms of protein content and avoidance of junk food, avoidance of oily stuff, fast food is absolutely essential. Physical activity at least 45 minutes a day with stretching exercises, skipping, badminton, yoga, Surya Namaskar, all these activities are important in terms of achieving a good outcome. One of the most important aspects which controls growth is sleep, because growth hormone is produced during sleep. So a minimum 8-hour sleep is highly important. The main factor which determines a child's growth is the parental height. So it's very important to really look at how the parents are to get an idea about what is the target height or the expected height for that particular child. So you measure height of the mother and height of the father. You average it and add 6.5 centimeters for boys and subtract 6.5 centimeters for girls. Most children who visit the doctor with complaints of growth failure and short stature actually have normal variations of growth failure. An important group of them would be those whose parents are short, and then second would be those who have a late puberty but would have a puberty at the right time. We also see a number of hormonal disorders like thyroid problems, growth hormone problems, adrenal problems, which can also present with complaints of growth failure. The most important thing is to actually measure the child. So you put the child behind a wall and you take a firm measure over the head and you measure using a tape. Once we have measured the child, we should then compare the child's growth to the growth charts, which are easily available over the internet, and there are websites which are able to allow you whether your child is growing normally or not. Time till which growth happens is limited, and therefore it is very important to reach to a healthcare professional at the right age. In general, the height for girls stops to grow beyond 14 years of age or approximately 6 months to 1 year after periods, and for boys typically beyond 16 years of age or once the voice starts to crack. The best time to reach a doctor is less than 10 years for girls and less than 12 years for boys. If you think that your child is shortest in the class, is growing less than 4 centimeters in a year, is below the growth chart, go immediately to your consulting doctors to look at the common conditions which can affect the overall growth of a child. Parameter which will tell us about how much growth is left is actually the bone age. So your doctor will definitely recommend you to have a left hand and wrist x-ray for the child. Very important to remember is that when you are getting this x-ray done, spread the fingers widely and ask the radiologist to cover the entire hand. Growth hormone evaluation is done at the last stage because any disorder will affect the interpretation. Growth hormone is secreted in a pulsatile fashion, so therefore if we do a single growth hormone, it is not going to give us any answer. So to look at the actual diagnosis of growth hormone deficiency, we have to admit the child, take a baseline sample, give some medications and monitor growth hormone every half an hour. In children who have growth hormone deficiency, those who were born short and who are not catching up by around 4 years of age, children with kidney problems and those girls with Turner syndrome, growth hormone is an effective therapy. Growth hormone therapy has been used across the globe for over 50 years now and has been remarkably safe.